Well, hello. We are here again. We are with Letitia Edwards, and we thank you for being here, Letitia, because obviously we feel that what you have to bring to this podcast is extremely important, and it is very helpful to know that there are others that are going through what you are going through. If you're a family member that's advocating for your loved one in a nursing facility, then you have support. And Miss Edwards' testimony of what she's going through is going to be extremely important to you. It's going to be very helpful. And so again, welcome, Letitia Edwards. And Letitia actually works for the federal government. And actually today is our anniversary, 14
Yeah,
years. So yay.
time flies.
Congratulations. So glad that you're still there because I'm sure it's been a journey there too. And also Miss Edwards is a veteran. She has retired from service, but thank you for your service. Can't say enough about our veterans and people who are serving in the military because, fighting for freedom is not free, is it?
Not at all.
So thank you very much for your service. We appreciate it. And so here, Justice and Change for Victims of Nursing Facilities. I'm Joanna Highskill, and we have Tracy Pompey with us also. She's our Vice President. And welcome, Tracy. And we are just going to dive right into it. Letitia's mom has been in a nursing facility here in Richmond for the past 2 years. Her journey in this process has been nothing short of extreme. And we've talked a lot about our personal journey, but now you get to understand and see that not only is it possible to advocate, but it's also possible to find the strength and support from others that are going through exactly what you're going through. So again, welcome. And Letitia, let's go ahead and start off. Just tell us, how did your mom get to end up in a nursing facility?
Oh wow. She's been there now about 2.5 years. I brought her up from Virginia Beach. My mother's married, and she lived in, an apartment with senior apartments with her husband. And I discovered during my visits that things weren't quite right. When a person has dementia, you don't know, things are kind of off, but you just can't pinpoint it.
Mhm.
So once I got a call from APS saying that the people of the residents at the apartment complex were some of the things she was doing. I mean, nothing malicious. My mom is, oh my gosh, she's never met a enemy. They loved her to death, but she was just invading on their privacy and, all times of the nights and wandering off. And it just, her husband was leaving her hours at a time because he was doing his volunteer and whatever personal stuff he was doing. So it got to a point where, okay, she needs somebody to watch her. And just things weren't adding up. When I would go there, she would leave food out that was raw. I don't know how long it was. And I knew my mother was a cook. And every time I go there, things were just in disarray. Things stopped piling up and just, piles of stuff, and she would buy stuff and she had no need to buy anything. And it just kind of reminded me when her mother, unfortunately, she dealt with the same thing. And she's not the oldest, but she's not the youngest. My grandmother had 11 kids. And she was actually the caregiver for her at the time when she had dementia. So it's just crazy that she ends up, doing that.
Mm-hmm.
Yeah. So the first time that APS got involved, I had to coordinate a meeting to figure out how to get her help. And a lot of it initially started out me coming out of pocket because, at the time I had to figure out the whole healthcare system and what needed to happen. So I had to do some research, gather paperwork, and pay someone to come and see her, spend time with her for maybe 8 hours a day. And this is Monday through Friday. Mind you, I got a real wide eye of how much it costs to have somebody pay
Yes.
$20 an hour.
Yes.
And so coming out of pocket, I was like, oh my gosh. And so I said, we need to figure out how to get this paid. So once that happened, I was out of the country. No, I was out of town with some friends. Maybe months later, APS got involved again. In between, her husband calling me all times of the night, expected me to get on the road and drive to Virginia Beach to come get her because she was being aggressive towards him. She was throwing things and just all kinds of stuff. And the things he would tell me she would do, I was afraid for either one, she was going to harm him or harm somebody. And his daughter, I hadn't met her that much other than when they got married. I knew she was a police officer for Virginia Beach. And the last thing I wanted was for my mom to end up in jail. So I said, let me reach out and call his daughter just to let her know what's going on. So happens that she was on a special unit where she dealt with dementia patients. So I was relieved on that aspect. So we kind of teamed up on each other to keep each other posted on things that were going on, because there have been a couple times the police were involved and they came, but she didn't get an arrest. They did a really excellent job, Virginia Beach police officers, in de-escalating situations. So, she has a sister that lives across the street, but she was never available. But I had to drive all the way down from Richmond to Virginia Beach to try to get things together. So once I found out that I knew something was wrong, I didn't know that he was dropping her off. Her husband would be dropping her off to any of her appointments. And I said, well, shoot, she can't advocate for herself if you're just dropping her off, because they ask her questions and she would say some off the wall stuff. So I started, unfortunately, it was in the midst of COVID. And we were remotely working from home at this point because I was traveling up to Northern Virginia, up at Fort Belvoir to work. And so it was kind of a blessing in disguise. I would take my laptop with me. I would find out, because when I asked him questions or her questions about who's her doctor, where's paperwork, I kind of had to do my own investigating to kind of figure out, okay, what insurance is she on? Then call and find out. And then I had a friend that gave me a shell to do dual power of attorney, because I knew I would have to dive in and get more information, because medical, they don't tell you stuff. So I did that immediately, got it notarized, had a friend that was actually a notary, a really good friend. And so got her to sign, and I worked around that and started collecting, figuring out who the doctor she had been seeing, and that was by way of getting her, what is it called? The EOB's explanation of, when they show the summary. Yeah. So that was how I had to be a PI in a way to figure everything out. And then once I got to find out who her primary care was, we had a conversation. I would always have to have sidebar conversations, because she would get extremely upset saying she didn't have dementia, ain't nothing wrong with her. So you can only imagine how that was.
Yes, it was difficult, I'm sure.
Yes, so I had to have her refer her to a neurologist, and we saw him, and I know what it was. She was always complaining of, that's what it was. She was always complaining of being in pain prior to this all happening. And her husband would send her to either urgent care or the ER. And my
Did she say where her pain was?
Couldn't find out. My mother has arthritis. Okay. So she has it everywhere. And for him to sit there and take her to the ER urgent care, that was a Band-Aid. I said, we need to figure out exactly what's going on. So I got it confirmed that she had arthritis, because she had accidentally, me years not knowing, accidentally took too many payments. And if it wasn't for him being there at that time, she would have gone a long time ago. This is prior to me even thinking about her having dementia. So when I would find out that he was taking her ER patients first, I would call them and explain to them who I was, don't give her any meds, explain to them the whole situation. And at some point they would not, even though at the time I think I didn't have power of attorney, but I would call and see who the ER doctor was and call and explain to them her history. And the most they would give her is Tylenol. So, but that was my biggest concern. And that's when I started getting more involved, figuring out her doctors, and then getting her evaluated by way of telling her, because she's a certain age, these are things we need to check. And and she went for it for a while, but I just had to tell her, because when you turn a certain age, they want to make sure you're healthy. And, she would go for it because she trusted me. And at one point, though, in the midst of all the drama, I came down there and it got really bad. I didn't expect that we were going to end up in the ER. I had to actually write a letter and pass it to the doctor explaining my situation because I couldn't verbally tell her because she was always ear hustling. And at the time, we were there from like the morning until late that night. I did not know at that time they were going to keep her. Social services there was going to place her somewhere, and I wasn't prepared. So I told him at the time that her husband would be able to take care of her, knowing that I knew that wasn't the case. So we ended up back at the drawing board months later, and that's when I determined that I got my girlfriend that's up here told me to get a psyche valve, and I didn't know anything about that, so I learned a lot. Got a psyche valve so that will be something that you can give to social services, deeming her unfit. And then I had initially got her license revoked because that was another thing. She previously had been in accidents. I mean, totaled cars. I didn't know, had no idea that what was going on in her mind. So all these things that had happened, I didn't connect the two. And once I finally found out, I immediately got her license revoked. And it
so
just.
When she was I'm sorry, I just had a question. I was wondering, so when she was having these accidents, her husband wasn't letting you know that she was having car accidents?
They would, and one of them, she actually hit instead of hitting the reverse, she hit the forward and ran into a building and had to cut her out the car. I did not. Yeah. So,
oh my gosh.
And then she had a couple hidden runs, but I didn't really know the details of it. But now, in hindsight, did I think back, I think she shouldn't have never been behind the wheel to begin with.
Yeah.
So, yeah.
Well,
and
maybe
then
if you were there, like you weren't there to sort of add these things up. So,
and then too, she kept. The biggest thing was her account was being significantly overdrawn, and it was like putting money in a black hole. I mean, we're talking $600-700. I would sit there and bring it up to zero, and I would tell specifically her husband, "Do not send her to the bank to withdraw." And on top of all the midst of this, I think he was taking advantage of that because come to find out, I said, okay, if her license is revoked and she's still constantly overdrawing the account, why is he taking her to the bank? So I found out that I think he was the one that was taking the money, and I found out that he had a gambling addiction. So that was a whole nother issue I had to deal with on top of trying to get her coordinated.
That is.
So I immediately got a hold of closing the account, brought it up, closed the account down, and we ended up getting in a confrontation for the longest time because I think to me, he wasn't necessarily in his right mind because he was going around telling people I was stealing her money, which my mother only got $800 a month, and I have no reason to take her money. I make, very good money for a living. So he was going around telling people that, which I ignored, but I'm like, they knew that wasn't true. And so I was having to come out of pocket with a lot of things, just making sure she was taken care of and trying to find resources. He wasn't doing none of that. And like I said, the second time we had APS get involved, and, because he did a lot of things like bowling and volunteering, he's a veteran too. And we told him he needed to make some changes, and he wasn't willing to do that. And so, it was like we were sitting there, all of us, the social worker, my husband, and then the company that we were going to get to watch her. And he just basically had an adult tantrum. So I knew I had to subtract him from getting things done, period. So,
can I ask you a question?
Sure.
How did you find APS when you were going through that initial stage? Like how were they working with you?
They called me because they reported that there was an issue. So some resident called and said that my mother was wandering and invading people's privacy. I'm sure, I don't know the extent of it, and they were afraid she was gonna, get hurt. She was gonna wander off next door, and they were on a busy road where cars were going fast, and there was a grocery store, and she wandered off there a couple times. She called me, remembered my number, and called me, and I don't know how to get back. And I somehow walked across the parking lot. So that's how they got involved, and they worked with me. I mean, they were very, you know, they knew where I was, where I lived, and they worked with me. And you know, I would keep them in the loop on what I was doing and different stuff. So that was how they got involved.
Okay. They were
Yeah.
pretty easy to work with a
Oh
long
yeah,
time.
oh yeah,
Mhm.
yeah. And so initially, the intent, it was never to bring her up here. The intent was to find places down there, but it kind of worked out because I was so busy being accommodating for everybody,
Mhm.
meaning her family. You know, of course, wanted her down there. And I told David, I said, hey, I'm sitting here looking at all these places in the Hampton Roads area. And I started looking at, found out how you can look at those reports
Mhm.
on complaints and stuff. And I was reading them. I was like, oh my gosh. And lots of times they didn't have any beds. I you know, figured out about that system itself. And I told David, I said, I'm going to widen the search to Williamsburg. So I brought it up, you know, kind of moved my way up to Richmond. And then I finally found a place. Initially, there was a place in Windsor. And, you know, when you have a gut feeling that something, I went and visited, she gave us a tour, and I looked at it, and I'm just like, you know, at the time I thought that was my only option. I had sent a mass email out to her sibling and told them where she was going to be. This was before Thanksgiving. And I ended up changing at the last minute because when my husband went back there and he saw it and the look on his face confirmed that just not the place for her.
Mhm.
So I had to continue to pay somebody to watch her, but she needed 24-hour care. It was a blessing in disguise that I had two older women that were retired LPNs, loved my mother. I mean, they knew how much her husband couldn't really take care of her. They would times want to keep her at their house. And because they knew he couldn't handle her.
Mhm.
And they loved my mother and they had no problems with her. So the only person she was would be combative with was him because he didn't know how to handle her, even though I would tell him, this is what you do, this is what you don't do.
Mhm.
I mean, he was just constantly going one ear and out the other. And at that
Mhm.
point, I was just like, you know what? I'm gonna just do what I need to do.
Mhm.
And I ended up bringing her up here. She ended up at the sister facility of the facility she's in right now. And that I really wanted her closer to me in Chester, but there was no availability. And she ended up initially in a sister facility over by Bryant Park. And now I heard it's a new name. That was a nightmare because it wasn't a locked unit. It was a memory care, but it wasn't a locked unit. So she would wander into people's rooms and stuff. And then I noticed that a lot of the aides there were congregating into the nursing station where I would go there at times and see things that should not be happening. You know, she hadn't been properly cleaned and her roommate, you know, got, you know, bodily stuff all over. And I'm just like, one time I was just, I guess I didn't know. I just, you know, it's my mom. I'm like, just like I do my kids, I just stripped the beds and did all the stuff myself. They were just taking their sweet time walking down the hall getting stuff for that. And I'm sitting there getting stuff and doing it. So, and then she finally ended up getting to the other facility because they said she needed to be in a locked unit, which I knew that she would end up down the hall and just everywhere. Not being combative, just sweet. Everybody loved her. Everybody knew her. But it's just, you know, she was invading people's space. And, you know, that's what happens when you're, you know, dementia. So once I found, I would, you know, complain about them. Once she got into the facility she's in right now, I just noticed things that weren't, to me, I thought wasn't the way it should be. I mean, I didn't know anything about how it should be. I just kind of, you know, observed and watched how the aides and the people that were there were caring for the residents. And to me, it didn't, that's not how I would treat anybody, a human being, period.
Yeah,
So,
but you can, but exactly, you know how a human being is supposed to be treated, you know.
yeah. So I would constantly speak
like
up
this.
and make notes and talk to whoever the lead person was. And they were really nonchalant about it. And so I'm like, okay, these people,
Let me ask you a question. When you went to just going back a little bit, when you went to initially put your mom in the facility, did you have a whole lot of paperwork to sign and so on like that? How did that process go in terms of your knowledge of what you were signing when you went into the facility?
Because I write contracts for a living, And when it comes to contracts, I'm going to read it, all of it, while I'm there and have questions. There were certain things that I did not want to do, which was, I think they would open accounts for residents or whatever and give them money. But I knew she couldn't handle money, period, so there was no need for that. So that was never, I said no to that. There was a lot of paperwork. I think that process should have been more than one day, because there were things that I wasn't aware of or should have known. When I go back and look at the contract, there were some things that I should have questioned that I didn't question before. I just wasn't aware. They just want you to, they tell you what it is, but then they're not really, really clear.
They're not clear because they want to just kind of move you through the process.
Exactly.
That was my experience. But can you imagine for somebody, about contracts, you around them all the time. But imagine somebody who just totally daunted by the fact that they're actually submitting their loved one into the facility, but then now
giving them authorization to do whatever.
Yeah, these contracts in front. And this is one of the things that we have spoken out about, because of the fact that you mentioned something that's very conceivable. It should be more than just, just right there in front of you. It should be a 2-day process, maybe, so that the understanding could be clear with somebody there to help outside of the facility. Somebody there to help clarify exactly what they're signing, because it can be very daunting.
Oh yeah.
And a lot of people who sign those contracts don't understand what they're signing. They're just signing it because they're being pushed through the process.
Yep. So I was kind of, like I said, I make sure I read stuff and make sure I wasn't signing anything that I wasn't relieving my rights to be the caregiver for my mother, because I didn't want anybody doing anything on behalf of her other than me, period. So that I did made sure I read and make sure that was clear. I didn't want anybody there. If something goes down, call me. Anything. If something happens, which a couple things have, they would call me. And but yeah, I did run into a situation where another loved one, niece is the POA, and she is very naive. She's a younger person, and the niece, because she's the only child, the father made her POA versus the sister. She's a lot older and seasoned, and they think because she's saying something that she that they're going to do something, retaliation. I said no, they can't do that legally. They cannot do that or put them out. I said no, they can't do that. So that's why might be going a little bit forward, but that's why I've stepped up to becoming the point of contact to form a support group for the facility in there now. So
I think that's important, because a lot of things that they're doing, they can't do legally, but they're doing it.
But people don't know their rights. They go by hearsay.
And they don't know. They don't know their rights, and they don't know how. Like, again, don't know the rights, and then if they even know, they don't know how to go ahead and implement their defense with regard to those rights.
Yes,
it's just it's unfortunate. So when you got into the facility, the second facility, how did you find things there?
Initially, I thought things were good to go. People were very friendly. They, like I said, my mother never meets a stranger. Everybody knew her because she was, Nana, she's a little bit less. She walks around, but she's really slow. She loves to dance. She loves to meet people. She's just a kind-spirited person. I would, still go by there and check in on her just to make sure things were going. I think when her clothes started missing, even though her name was on it, and just the way they would upkeep housekeeping, I knew that's a major issue for me, housekeeping. I just thought, I said, why am I coming here and I see certain things that shouldn't be happening? They're the soil pull-ups and the open wastebasket. Because if you figure you have one room with that, have multiple rooms, the smell is just unbelievable. So I would bring that to the attention of the director of nursing. And I said, is this your standard practice? And she was like, no, it's not. And she claimed that she was going to, have a conversation with, the staff or whatever. I don't think she never did, because actually she got relieved not long ago. And just certain things were happening. It just didn't make sense. So, and initially before they started locking their clothes in the wall lockers, which was a good idea. Everybody would go in each other's closets because, they're dementia patients. They don't know. So they would do that. And then when I would ask, I didn't realize that there was agents versus employees. The right hand didn't know what the left hand was talking. They didn't know. They don't have a good Passover when it comes. One person leaves, the other person doesn't. I asked the question, they look at me like a deer in the headlights. Oh, it's awful. So I'm still dealing with that now. And the biggest concern was the codes to the doors to get out. That to me was a big fire hazard. And I get there and I'm about to leave and nobody knows what the code is. And they're walking around asking people, what's the code to the front door? What's the code to this? I'm immediately thinking, that's a safety hazard.
It is. In case of fire, anything. Wow.
And I've asked, and the one thing that I did ask once I've started observing stuff, okay, when do they do fire drills? And then I just started Googling stuff. I'm always one for researching, and Google is your best friend. I found out so many resources about the senior, just the senior care and just the organization, the resources there are. So I just start reading. I would stay up 1, 2 o'clock in the morning just reading. No, I should be going to bed, but I just would get stuck on looking at stuff and finding out stuff. And that's how I was able to, do what I am now.
Advocating like that, it does take work. And what I'm afraid of is that there are a lot of people who are not able to do that for one reason or another. And this is why podcasts like this is so important, because they in fact can find out about what have not been able to find out themselves. I know for me personally, I did the same thing a day. I was reading like crazy, trying to get a grip, because did you feel like you were just kind of just thrown in the water and you had to just, you had to figure it out. And so I get it,
I didn't know how corrupt that the system was. And I just was like, I had to figure out the social worker's job, what they're supposed to be doing. I started I have like 4 binders now of all of my mother's just stuff, records. So if I needed to get a hold of something, I got, whatever cards I need, medical cards, all of her medical, the EOBs that come through whenever they do something. So I started, and it's funny because one of my girlfriends that actually owns a group home, so she's been doing it for years. And when she saw my stuff and a lot of the questions that should have been asked of me, or the work that should have been done by the social worker, she was like, damn, she said, you did all their work, everybody's work. She said, you are very thorough. And I guess my husband said the same thing. So I just knew if something happens to me and I know if somebody needs to get a hold of something, everything's there. I had to categorize, as far as her, when she first got approved, just everything is in there. I keep track. And, I didn't understand. I thought that the social worker's job was something I was really frustrated, and I figured it out. So, okay, that's not their job. They're the ones to get them qualified. Once they're qualified, then I pretty much had to do the legwork for everything else.
At any point, did you think about, not that, some people can, some people cannot. Did you ever petition or ask social services for your mom to maybe get 24-hour care at home as opposed to going to a facility? Was that ever something that you thought about?
I did, but I saw that based on when I got her qualified. The other challenge was a lot of these agencies that hire people to do it, I realized that the issue was staffing.
They had staffing issues.
So I found out how the hours work. You got auxiliary hours and you have certain hours that they're required to work. And even if I did, it just wasn't possible because, it's the staffing. staffing is a challenge for the companies that supposedly hire these people. That's the biggest issue. That was a big obstacle. So that's when I knew. And then the ladies that the retired LPN, semi-retired, told me, you know, your mom, she needs 24-hour care because her husband just could not care for her at all.
So the reason why I asked is because I know with my experience, when I petitioned them for 24-hour period, the social service department, I was given the minimal hours of, I think she said 32.
Yeah.
32 hours that I had qualified for, and that's it, which didn't make sense to me because I was working at the time and had to pay out of pocket to make up for the additional hours. Like you said, it does get extremely expensive. But the 24-hour period thing, that's a highlight that we're actually, one of the highlights we're focusing on as well, because to me, it seems like it would be more cost effective for them to have 24-hour care at home if they could, if the person is able to accommodate their loved one, to put them in a nursing facility, because of the fact that there are so many other expenses that come in to play when you have family in place in a home that covers a lot of that. So better care. For me, I know it was just searching out, putting the word out there, because I went on and, you know, put the ad out there, you know, looking for this and that. And then I got with an agency that provided the staff, but then you had sometimes people come in your house and they do things they shouldn't do. And then you have to, you know, tell them don't come back anymore because, you know, you did bad things in my house. But at the same time, we really met some really nice retired LPNs that came in and were just fantastic with my mom. I thought, wow, you just can't afford it anymore. You know?
Yeah.
And that's the part that I think needs to really be looked at. Giving people the option in social services to have their loved one at home with round-the-clock care. Because, you know, nursing facilities are complaining about short staff, you know, being short staffed now anyway, right? Where are they going? Where are they going? A lot of the staff, where are they going?
Yeah.
They're going to agencies and private nursing. A lot of them are going to private nursing.
Yeah, because they pay more. Yeah,
that's true.
Yeah, you get.
But then some of the agencies too are having issues with staffing because some of the employees may have babysitting issues or transportation issues. That's the two things that I fell into. And then one of the agents that I used, the young lady was there, but she wasn't there. So my mom wanders off. She's on the telephone having a conversation that she shouldn't be having. And then one time, one of the agents was asleep. So my mom wanders off. So that would be a hard thing to do because if you have somebody 24 hours, you have to do it in shifts, but who's willing to do that? And then you got to worry about babysitting.
Well, I think I ran into that as well. Met one of the ladies sleeping. My mom, we had an intercom system. So my mom knew to buzz me, and she buzzed me because she couldn't reach the caretaker that was there. She was on the sofa sleeping. She was knocked out. So I came downstairs and, you know, saw her sleeping, and I was like, okay. So yeah, you run into those things. I just thought I'd ask because I want people to understand that that is an option to investigate. I don't know if things have changed now. I seriously doubt it because the system is so corrupt. Things just don't operate normally when you're in this field. But you know, it's a question that can be asked. There are a lot of other services out there now more so than when I was going through this that will listen and then try to get you help in one way or another. So I just wanted to put that out there. So how is your mom doing in the facility now at this point? Because it's been 2 years that she's been there. I know that you have walked through some dangers, toils, and snares, if you want to call it that.
I've
I
had
know
some
it's been
serious
kind of rough.
challenges.
Yeah.
It has been, even though she's been there. I've had to have come to Jesus meetings with the staff. Just recently, I had a meeting that ended up being 2 hours and probably could have lasted longer. Ended up corporate came down as well as the leadership that was there. We actually had a
Describe how you
long.
did that. How did you put that in place?
Well, there were too many times I had been emailing the administrator or the people that the leadership of the facilities. I would always keep them informed by emails because I know the only way you can get their attention is for me by way of emailing them. And I would always take pictures. So my cell phone, whenever there's an issue, because you have to get it in writing. Because hearsay and word of mouth is just, they can deny it. So
But that paper trail, exactly.
So I had to have a
paper
trail. Now,
Yeah.
initially, the administrator that was there prior, he would never. I had to find out what their email address was. And this is funny. I would email him once. I would email him a problem. He never emailed me back.
Right.
And so he would, out of the blue, would call me. I could be on the way home or whatever and call me. I forgot about the email and in the middle of something. Don't even know what I'm doing. And so once he finished the conversation, when I get back home, I would say, based on our phone conversation, this is what you discussed. And so I would constantly do that. And, and then when I would have an issue about things, like I said, I would take pictures, send it to them. Hey, is this your policy? Is this your protocol? So eventually I started running into residents' loved ones. I would catch them, on the way out, on the way in, and start saying, hey, how are you? What's your satisfaction of this facility? And so that's how I ended up getting to know some of the residents' loved ones and how they felt about what was going on. So they were experiencing the same frustration, and they were getting the same response, nothing. So I started emailing. I took it a step further. I ended up finding out there's ombudsman, and a lot of people don't know about that they are a person that will speak on your behalf. And the ombudsman that I deal with, she's on it. She will pop up there at any given time. As many, even though her plate is full with different cases, same facilities most times, she will pop up, and I would blind copy her as well as others on what's going on. Once I started with her, then I would find out who I need to file a formal complaint with, because I didn't understand that the long-term care versus, I think, rehab have two different sections. They fall up under DSS. And there was a specific email that you would send a complaint to, and they would investigate. Because I read some of the investigations of what happened. And once that, at some point, to me, wasn't enough, then I started finding out who my local politicians were. And unbeknownst to me, I didn't know I was going to really get a response. One of the politicians that was running or was in the process of running thought it was when they saw the pictures of the stuff I sent, and I don't apologize for anything, they were appalled. And I think because they were in the midst of election, that's another thing. You got to follow up, be persistent. They're saying that they're going to look into it, but I don't know. It gets handed off, because I finally recently sent to the lieutenant governor's office, and they sent me this, generic letter about sending it to the appropriate people. So basically, they probably was going to send it to the people I was going to send it to, Department of Health. And you just have to be consistent. And what really got them was when I thought I knew the CEO, the name of once I found out, let me back up. Once I found out that the company was being taken over by another company, I went online, found out their email address, and said, who's going to be in charge of this region? And I found out who the regional operations person was. I went on LinkedIn. You can find a lot of people on LinkedIn. And I found out who he was, reached out to him, and he tried to deflect me back to the administrator. I said, well, the administrator is not doing his job. So I started going forward emailing the administrator before he had quit, and then CCing him on it so that he knew I was always communicating with him.
Mm-hmm.
And like I said, he had me last a year, and he ended up quitting because he couldn't handle a lot of the stuff that was going on.
Mm-hmm.
And so recently, when they thought I had sent an email to the CEO of the company, and I CC'd the regional operations and all the leadership at that facility, that's when I lit a fire up under them. And they start calling me because at some point the regional operations guy was not responding to my request. And so now, a couple of weeks ago, I was really tickled. I had to laugh myself because on weekends there was no housekeeping, which is crazy. These people make mess 24/7.
Exactly.
To not have housekeeping, I mean, it was just
on the weekend.
How it smelled. You know, nobody knew what housekeeping was, and nobody showed up. So to me, I don't care if you need to have a contingency plan. I told them, you need to have a contingency plan. If the plumber that they had assigned is not there, you need a backup to the backup to the backup.
Mm-hmm.
So I was sitting there telling him his job. I said, what is your SOP? You know, standard operating procedures. And, you know, I said, this is ridiculous. So I kid you not, a couple of weeks ago when it was on Juneteenth was when I had the 2-hour meeting. Prior to that, when, like I said, I lit a fire up under them the week before, all of a sudden, I ain't seen so many cleaning equipment people at the facility on a weekend. I laughed so hard. My mom's room was so clean, the floors, I could literally see my reflection. And then I would get so mad when I go there around dinner time. The dining area was just disgusting. They never used to strip and clean that floor every day because there was too many times I would see trails of just stains and food. The staff wouldn't clean it. They told me they would wait for housekeeping to come. And I said, somehow these aides should be cleaning too.
Mm-hmm.
And, you know, everybody's want to stay in their lane. Some things, you know, common sense.
Mm-hmm.
So the floor, the carpet, even, you know, when the ombudsman, when I sent the thing to them and then I got the ombudsman involved, she spoke to the leadership at the facility and said, you know, this has been going on way too long because I have been copying her the whole 2 years. And she said, when you get to this meeting, you need to explain, you know, to Ms. Edwards, what are your plans going forward? So, like I said, they had corporate representatives there, they had the leadership there, and the acting, just recently, I said, Lord, you can't believe anybody. The acting administrator quit. Or let go that about a week or so ago after he, you know, told me, you know, to my face and at the meeting, this is the thing they're going to get done. So I was able to put names and faces with the point of context that I need to speak to going forward. But still, I'm not going to just go by their word. I'm still checking in. I would go there and see her every other day. I never told them when I was coming or if I was going to be on vacation. And then if I was going on extended vacation, usually one of my girlfriends, I tell you, I have a really good support group. My girlfriends would say, you know, I'll go by there. You know, it got to a point where her clothes were missing. I said, don't mess with her clothes. I clean them myself. I go there and get them. And when the ladies showed me their laundry facility, they need to outsource. It's to the point where I don't know how they're going to catch up. I mean, they got piles of bags of soiled people's clothes. They don't have any organization, so I'm not sure how they're going to work that out.
And see, that's probably another reason why the facility smells the way it does.
Your laundry.
Yeah.
I would bring myself and another lady. She would always bring her cleaning bag full of supplies because my mother has a roommate that's in a wheelchair. And even though they tried to make them independent with going to the restroom, there were things that were on the floor and on the walls that shouldn't be there. And so anytime I would see her attempting to try and go to the bathroom or whatever, I would literally call them. I said, Miss So-and-so needs help in the bathroom, you know, because they're down the hall congregating. And another thing I would bring to their attention, which would make me mad, is a lot of these aides at night or during, not so much, I don't know during the day because I'm not there, but I would be there a lot in the afternoons. There's someone in the corner watching TV on their phone. There's too many things going on that needs to be done that could be done while they're asleep. And I'm constantly finding, the trash bags with soil stuff in there.
Mhm.
And she claimed that they're supposed to, once they change them, they're supposed to take those bags up at that time and put where it has all the, biohazard stuff. And it's still not happening. And initially, what really, really, really made me so mad was when she first got there, a lot of those people were doubling up on her pull-ups. And I said, is this your standard practice? I said, that can cause a lot of problems for her, UTIs and stuff like that. I said, that's just being downright lazy. Somebody's not doing their job.
They would put 2 pull-ups on her?
So, and they did it on more than one occasion. And every time I would find her with that, I would bring it up each time. And I said, what is going on? And she claimed it was not their standard practice. So why do I keep seeing this? And I would take pictures, or they wait, they wait too long to change them. And then another thing was they would have these, I would have to demand these quarterly meetings, and then they weren't tracking that, where I would have a meeting with all the staff on her progress.
Mm-hmm.
And I would go there in afternoons, and my mom's at a point where she can feed herself, but then there's some distractions that she has. I have to make sure she doesn't do, like have her drink in front of her, but she'll start mixing stuff together. And there was a point where one time she wasn't eating. Oh, and that was another thing. I had gotten 2 years worth of her records prior to me bringing her up there from her previous doctor, because I knew she had an issue with not being hydrated, being impacted. So that was a Saturday, I never forget it, where I thought she had to go. So I said, there's times where I will just go ahead and change her when I'm there myself, because I know there's no short staff. I'll do it. And that particular Saturday, I walked her to the bathroom, had her sit down, and I thought, I said, okay, there's nothing there. Kind of find out she was severely impacted and do an enema. And I was so hot. I said, if they couldn't approve it, I was going to leave, go to the store, bring it back, and somebody was going to do it. But they had to call and get approval. And I was just frustrated because they said, she hadn't. I said, when was the last time she went? It was like, this is Saturday. Last time she went was Thursday. So they don't even track.
Do they? I was just going to ask that. They didn't document. They're supposed to document that daily.
They claim they do, but every time I'm asking them questions about when's the last time, what color was the urine, this, that, and the other. And so at the meeting, to the director of nursing claim, I said, and as far as food goes, she's gonna tell me this bold-faced lie, because they have this little piece of paper with stuff that just don't even necessarily match with what they eat, that they track their food. I said, well, why would you do that? Hospitals don't do that. What's important, you track what goes out. They don't do that. I said, that makes no sense to me.
It doesn't make sense at all. Because if she had remained impacted, if you
I've been there.
Yeah.
That day, tell them what would have happened. So I had to, and then another thing was they found out that, after a while they started having trouble swallowing certain pills. And I think her fiber pill was the biggest one. Mm-hmm. So in my mind, I'm thinking, you got to think like a child. Mm-hmm. Let's try fiber gummies. Mm-hmm. And that's what I'm having to buy and bring to them is gummies. Because, pills start to get hard. But I knew she liked something sweet. So I knew the gummies would work. Mm-hmm. So that's now what I'm having to go do is pick up fiber gummies, because the doctors can't order that. So I do that and have them give her that.
Oh, did they tell you why they can't order that?
I don't know if it's because it's over the counter, but no, not necessarily. Mm-mm. Nope. So I come out of pocket with doing that. Getting her those.
That's interesting.
She has a couple of health concerns that her doctor had been keeping track of every year. And one of the tests, her previous doctor was doing an ultrasound on her liver, and right now I'm battling them having to do certain tests. They said that they won't do it, ultrasounds, that they'll do it through blood work. I don't want to wait till it gets to the point where it's showing up in the blood work, because from what I understood, the tissue that was damaged could turn cancerous. And so I had a meeting, a video call with her previous primary care doctor, and there were certain tests that she had requested recently that she didn't want to step over her primary care that's there. Mm-hmm. And I've never met, and that's another thing, I've never met had a meeting with the actual primary care doctor. The one that does all the work is the RN. She comes and does the rounds. And I don't understand why I've never physically seen him. I saw, you know, I had to research and ask who he was, but I've never seen him come into the facility to meet with the loved ones. I don't know why.
Let me suggest that you reach out to him or the nurse and request that you meet with him and put that in writing as well, because that doesn't seem like normal at all.
I can understand meeting him for the first time and saying, hey, this person is going to be the person
Right.
that does, you know, the primary, but to have never met him the whole time that she's been there,
I mean, does he even come to the facility?
not that I'm aware of.
Mhm.
So to me, I feel like he's getting paid to be attached to that facility.
And that's a problem. That's a
That's a major
problem. That's a major problem. That's correct. I know I made it a point, and I've had to request meeting my mother's doctor, because I went like about a month or so, and I realized I hadn't seen her doctor, but yet all these orders are coming down and no discussion with me. And I put it in writing, and I let them know that don't send your representative, don't send the RN. I would like to meet you specifically to discuss my mother's condition. And I did. He came down, he did meet with me, and I just made it clear to him that I expect him to at least put eyes and ears on my mom on a
Totally,
regular
at least.
basis, because that's what's expected, you know. I don't know how it is with your mom when it comes to dental treatments. When it
Well,
comes
she doesn't have any, but the eye appointment is funny. You said that the director of nursing could not elaborate when I had a meeting as to, you know, dementia patients, you can't do a thorough eye exam with them.
right, it's hard sometimes.
She could not verbally tell me how the exam was done. I had to get it from the LPN, and then I told them the next time the doctor comes to let me know so I can be there. And so the last time they did, because I'm still like, you can't get them to read an eye chart. What are you checking? And that's what I wanted to know, because it's not going to be a full-fledged eye exam
Right.
that we take. And I couldn't believe she could not answer that. I said, that was the wrong answer when she said that she didn't know. As a director of nursing, you need to know, even administrator.
Well, there's a bill that's being submitted to Medicare or Medicaid on behalf of that exam. If it's not a proper exam.
I met the eye person and basically the eye doctor, and basically what they do is checking to make sure that they don't have, I guess, glaucoma, cataracts, what have you. But it's not to the point where, you know, because they can't communicate, you know, what they see.
Right.
So they're not, so it's not really a thorough eye exam.
I was going to say, and also follow your direction as to, you know.
Yeah, I was thinking the same thing.
So they're not going to.
She has a permanent lens, and I think it's a right eye. And that was one of the concerns. I just wanted to make sure that it was still in place. And then I think she had, unbeknownst to me, before I knew, down in Virginia Beach, she had the cataract surgery or something in both eyes. So, you know, I just gave them whatever history I had and gave them the doctor's names and stuff. But I don't think they really look at their medical records, because when I told them about her history of a, you know, heart disease, and, you know, she had the hepatitis where they needed to check. I mean, she doesn't have any more, but the primary would do the ultrasound on the liver just to make sure that there's nothing wrong. You know, I'm having to repeat myself with all these things. I said, they clearly are not reading her records.
Now, speaking about the records, this is another question I wanted to ask you. Have you gotten or retained any of her records from the facility?
Honey, you asked that about a month ago, and I'm really mad about it. They want me to pay for it. They have never provided me with. I said, I think one of the emails I might have sent to one of you all, my blind copy, I'm like, you guys can't even buy the proper supplies for the facility, yet you want me to spend money on copies of her records that I don't even know what you're doing. And they initially didn't want to give her a COVID shot because it wasn't state mandated. But then to me, I was thinking outside of the box, why don't you just do a community? Because, you can't just order one vial. You got to do like a certain case. Do a community vaccination so that everyone is open to everybody. So they finally did that months later. I was supposed to have taken her out to get it done. And then I said, well, since they were going to do it, I said, well, can you give me a copy of it? Because I have the records of all of her
Right.
a poster. And yeah, they want me to pay for a copy of what they've been doing.
How much were they wanting you to pay? Did they charge you per page, or did they charge you?
I have not bought it yet, but they want to charge me per page. It's either 25 or 50 cents per page. I don't even know.
Cents. Yeah, it's 50 from your email. What you were saying from your email, you were saying it's 50 cents.
Okay.
And then any page after that, 25 cents.
Okay, that's what it was. And I just
depending on how much, depending on how many records you want, that could be a lot.
It is. And that's the thing. I don't know, since she's been there, what they've ordered. I just recently, by chance, the other day, before I went out of town, saw that they took some blood work because she had a Band-Aid on her hand. And so I had to ask what was taken. And so I need to know what the results are. So you mean tell me I got to pay for that?
Yeah.
And there was specific blood work that her previous doctor wanted to tell her doctor now what he would like, what she would have liked for him to do. And I don't even know. I have the number to the RN, but she never responded back to me. So it's like the communication is just awful.
It's a deterrent, right? I made the same mistake with my mom. After a long while, I said, okay, I need to get her records. Long story short, it was going to cost me over $500 to get her records. And that's a deterrent. But it's important to get them if you can. And so my suggestion is, when you go up there, just ask for her record for the last 24 hours and accumulate them. Just, even if you don't do it every time you come, you just ask, can I have a copy of her record for the past 24 hours? Because what's going to happen, at least you'll have something. And if there are any consistencies, God forbid there's anything that happens, if there are any consistencies, because we all know that they happen to change records and wash them when something happens.
They do. And the thing is, I think, the person that I normally deal with, she's out of the country for 2 weeks. And the nurse that I talked to before I left, I asked, what was it that they drew? And it's like they don't have a system. They're scrambling to find stuff. And I mean, things should be really, really organized behind that counter on what's going on, or pull up on the system. So they're not very efficient when it comes to, when you ask them for stuff, they're humming and hawing.
And I think that, I don't know if that, I want to say subjective, that is subjective, because if there was a court order that came down that asked them for that information, they'll find it. They'll have it.
Oh.
And then when I did ask them for one time, just some time back, for a copy of something, instead of them just giving it to me, they said I had to reach out to this one lady to fill out a form, and then it took forever. And then they had the nerve to formally send it to me certified. But yet, so they have a system on their end, but for me, they can't, give me a printout on demand.
Yeah, I would, just as a suggestion, when you go up, just look, can I have a record for the past 24 hours? That maybe is 1 or 2 sheets. If they wrote anything, if they actually wrote anything, 1 or 2 sheets, that'll be what, like $1? But even if you don't do it every time, at least you'll have something over a period of time. And if, like I said, if there's anything that seems squirrely on her records later on, you will have something to fall back on, even if it's not the whole thing.
Yeah, and I recall that the last time I did get records, they didn't say there was a charge. I had that stuff here, and I was questioning some of the stuff, but like I said, I don't trust what I get from them because I
Yeah.
don't think
I
I
understand
think
that.
they're doctoring. Yeah.
Yeah. Oh, yeah. Oh, without,
And we
I have
know
no
they
doubt.
doctor them. Yeah.
So
Yeah. Yeah.
as people are listening to you
Mhm.
right now, and I'm sure, many will probably want to have questions that I'm not thinking of or that Tracy's not thinking of.
Mhm.
What would you say to someone who is desperately trying to navigate through advocating for their loved one in a facility that, because we know of quite a number of them, not even just in the state of Virginia, but we
Mhm.
get calls from outside of the state of Virginia.
Mhm.
Mhm.
So this is really nationwide, but
It is.
we can't even get our representatives in this state to pay attention.
Nope.
And even if they give you the politically correct response, there's
Mhm.
still no action afterward. Um, and it's unfortunate because we're not going anywhere. We're going to continue advocating. We're going to
Yeah. No.
continue sounding the alarm. And what we keep
Mhm.
asking people to do, don't just sit and take it. Speak
Yep.
out,
Yep. And
advocate.
that's.
Because
Mhm.
if they don't have a voice, you have to be and step up. You have to be the voice for them. How would you suggest or how would you tell someone um, how to navigate through that?
Definitely initially, if you see a problem, bring it to the leadership's attention at the facility. If they do not correct it, then I would definitely go on to the site. I believe it's aging to speak to an ombudsman. And people don't realize that's a free service. They will speak, they're like an arbitrator. They will speak on your behalf. You let them know what is going on. They will come out to the facilities, inspect the facilities, and they're going to be on your side. They're not, they have nothing to gain. They're going by what the state regulations are and what they're supposed to do. And that's where I would start is with the ombudsman. People don't realize the rights that they have for their loved ones and the rights as the caregiver what they have, and that's why I went on to the site of the Alzheimer's Association, in particularly to I found tons of resources with them, becoming a volunteer, and then having a forming a support group for your facility. Because right now, as it stands, like you said, it's a nationwide thing. I know people say, well, I'm going to pull my loved one out of the facility and put them in another one. That's just like playing a game of hot potatoes. It's not going to make a difference. You're going to run into the same situation. So that's why I made it a point to start at my mother's facility and advocate there and make my way. Initially, my long-term goal is to make it to DC with, because this is on a federal level. The major changes is on a federal level with staffing and better pay. So.
And this is what we've been saying the whole time that,
Exactly.
like you, we intend to make it to DC and speak out. I think that another good point is when you are advocating, can you talk about some agencies or some contacts that you made that were support to you?
Oh yeah. Of course, the Alzheimer's Association. I saw, because I live in Chesterfield County. There was they have like a senior newsletter, and it was a lady that was going to do I guess like a seminar or something talking about senior care, their rights and loved ones' rights. So I saw the person's name and looked her up. She was a program manager, and I explained to her. I shared with her my story. And she was just like in shock of all that I had been doing. And from there, that led to me finding out the resources that they offer for free, because basically I didn't know DSS gives that organization and others grant money to do free training to the facility itself, if they're open to it, and also for the caregivers, loved ones, and providing the resource, the information about what their rights are and what they can do and all this stuff.
That's really good.
And then to top that off, I actually, like I said, Google is my best friend. I found out that there are organizations out there. There's one up in DC called National Consumer Voice. It's for quality long-term care. This organization in particularly is amazing. They've been around for a while. I read their bio. I read some of the things that they're doing. They do an annual conference, and they have lobbyists, and they're constantly, please, 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 I would stress to you, get on their email page. Because they talk about the things that I am going to be strongly advocating for going forward, even after my mom's eyes are closed. And it's not like the staff doesn't care for the people, the residents that are there. They just are, their hands are tied. They're assigned, 20, 30 people in an 8-hour shift as opposed to give quality care. That don't pass the common sense test. So they cannot give the quality care. Just, I would advise people to look onto their website, look at some of the podcasts and webinars in which these employees talk about what they're having to deal with on a regular basis. And it's just horrible. And, even the residents, they can tell when they're short-staffed, when they're being rushed through. So that's one of the organizations. And also, the Virginia has their aging, was it Virginia for Aging site, where you have the resources there to speak with the ombudsman. They have resources on their page to speak if you need a legal attorney. They got attorneys for the aging. And there's just such a wealth of information that Google has that there's no reason why you can't get someone to be able to listen. And, like I said, document everything. I don't care how small it is. Document everything that takes place at the facility and take pictures. I always have my phone ready to take pictures. That's
Letitia,
what I
Letitia, let me ask you, so you've been very diligent. We see that you've been very diligent and, not intimidated by anything, any facility, any staff, right?
Good.
No.
But what advice do you have for family members that might feel intimidated? Well, I'm intimidated by the staff and the administrators. I feel intimidated. I can't do all of what you've done. I feel intimidated by that because my loved one is going to get retaliated against.
And I get a lot of that response back. And I said, legally, they can't. I show them or tell them the website that provides, even though it's written in stone, people still are hesitant and think that they're going to be retaliated. They cannot. Whenever I talk to the staff, I'm not nasty. I'm cordial. I always get their name, especially if I hadn't seen them on a regular basis. And I say, who are you? Have you been in this? Are you going to be permanent in this department or what have you? But you got to communicate with the staff members and, let them know, hey, this is my mother, this is my brother or sister, and like I said, they know me. Everybody in that building knows me because I'm there every other day. I know there are people that can't be there every other day because they may have their loved one, they may be out of town, but just communication. You ain't got to be their friend. You don't have to be their friend. And you don't know what that staff member is up against because that's their livelihood. A lot of them can't even say stuff because, like I said, that's their paycheck every day. I can be empathetic, but then I'm gonna also say what I expect of them.
The flip side of that, though, have you met any of staff members that are rude or disrespectful?
Not to me. I wish they would. I just have always had that demeanor, and I guess I get it from my mom. Nobody intimidates me. They
No,
try.
it's just, I get it, because I go through the same thing. I go through the same thing where, but I have met, or overheard staff talking to my mom on, while I'm on the phone with her, that were
Mhm.
rude and very disrespectful. But again,
Mhm.
like you said, they haven't done it to me, to my face, because
Mm-mm.
that persona, you know, when I walked
Mhm.
into the facility,
Mhm.
there weren't bells and whistles, you
Yeah.
know,
Yeah.
but I get it.
Yeah, I make it known who she is, and actually it's funny because a lot of them know her before I even tell them that that's my mother, and they're like, because like I said, she never meets a stranger. She's just so, this is the sweetest person ever. And not saying because she's my mom, but that's just her demeanor. But if you catch her on the wrong day, yeah, if you do something, say something wrong, they know my mama is a Spitfire. So like I said, I probably acquired a lot of it from her.
Mhm.
But they should never ever be intimidated, because to me it not only, I mean, just like in your job, I mean, if you have a supervisor or somebody that is treating you a certain way, you're gonna accept it. You just can't. As a human being, you cannot allow somebody to talk to you a certain way or act a certain way just because they may feel that they are superior. They're
Yeah,
not. They
yeah.
just can't. And all these things. Yeah, I do have a resident loved one that said, that claimed that their family member is in the system where they are, CNAs or what have you, and they're telling them garbage about what they can do. That is so untrue, because yeah, I hear some stuff from my extended family members that are CNAs. I mean, they tell me the real deal of what's going on prior to her going there, which I had already observed. Yeah, they say some stuff that I don't really care to know or hear about. But if I'm going to hear about it, I'm gonna report it to somebody.
Hmm.
You know, and even if it's not my mother directly, if it's one of the other residents, because I know one day I was there one night with my mom, and diagonal across the hallway, a guy fell out his wheelchair to get in his bed. And I'm not a CNA or nurse, but I know how you would care for somebody, because most people have children. For one, it should have been two people. It was just her. She took her time going down there to get him out of the floor. And then the way she pulled him up, she could have broke a bone, to pull him up by one arm. You needed to lift him up at
Hmm.
least, from
Garden.
behind and get him in the
Hmm.
bed. And she did not do that. And then I waited a little bit longer and stayed there later than I normally needed to see if she was going to do paperwork. And I, left out of my mom's room, and just out of concern, which, I knew, I said, is he okay? I said, so you're gonna do paperwork to file paperwork of what happened, right? She gonna do it. I don't think she never did it, because you're supposed to do that right then and there whenever
Hmm.
something happens. Just like
Hmm.
if you were in a store and you fell,
Hmm.
you're gonna do paperwork. So I know she never did it, and I reported that.
Good.
So you gotta say something. You can't just let stuff happen and don't say nothing. I mean, don't say anything. Things don't happen.
Well, I mean, that's the hope. I mean, because, I went to visit my mom. She had stitches in her leg and nobody could say how it got there. The doctor didn't even know how it got there. Um, there was nothing documented, apparently. That's the hope that,
They call me now for every little thing, because the other day I was up in visiting a friend out of town up the road, and she tripped and fell. She was running and she fell, and the bruise looks worse than what it is. But the next day, of course, I went by there to put eyes on her. So, and I was there for an extended period just to make sure she was okay. But they call me for every little thing now, because they know I'm not playing with them.
because they know you, right? They know that you're on it. And how do you find the accountability now that you are advocating so strongly?
Mhm.
How is the accountability to what you're doing?
They will sit there and volunteer stuff that like because I personally, like the other day, the lady that they put in place to be in charge of that section, um they will tell me, oh, we're taking care of this the next day. We got a group of people, because like the laundry, I don't know how they're gonna do it. But I was going to go in there. There's some article of clothing that is missing. And, you know, like I told them in the meeting, I don't have that kind of money. I mean, I got money, but I don't have the money to be constantly replacing stuff.
Mm-hmm.
And there's been two sets of shoes that are missing the other half. And I said, they obviously are not doing inventory. It has to be in somebody's room. And I was going to go in there and look for missing items in the laundry room. But when she gave me a tour and showed me, she said, no, I don't want you to do that. She said, I'm having people come in. I said, there's no way. They're going to find this. I mean, it's no system. It's a hot mess. So, and then they claim that they're not responsible for replacing them monetarily. So I'm like, I'm finding a hard time with that one right now. I got items that, you know, they said they can't monetarily replace or file a claim. I know they got insurance.
Mm-hmm.
So I'm not sure. I got to do a little bit more investigating on that piece because I don't get that. You know, especially if it's still in the facility.
Well, I mean, as we're wrapping up here, I think that I'm sure that people are going to get a wealth of information and help. Is it possible that you are creating or that you have other family members that are joining you in your advocacy in this particular facility, or has that been a struggle?
Since the time I've taken charge of my mother's affairs and just making sure that she's cared for, nobody's volunteered. Only person that has been by my side the whole time has been my husband. You know, he had gotten as far as looking at moving, because we have a 2-story house with a basement, to a 1-story to have her live with us. But no, I've had to do this solo, and I do have siblings. And then my mother has all of her siblings down there, and no one's there to say, what can I do to help? I had one older cousin that's on my father's side, that he was the only person at the time that was trying to find meals because she wasn't eating properly, because neither one of them, you know, she would say she's gonna cook, but you know, they forget. Mm-hmm. He would say, what can I do to help? I was literally in tears when he told me that, because everyone else was just, well, that's your mother, you need to take care of her. She took care of her mother when she was there. And, you know, it's just, and to me, I've gotten over it, but it's just very disappointing and sad that you would think in times like this that family would come together and say, hey, knowing that I was making a 2-hour trip, you know, around really 4, because it's an hour and a half to get down there, and spending lodging and gas and stuff like that. I was doing that for 2 years, and nobody once volunteered to say, hey, can I take her to one of her appointments? I did all of that. I shouldn't have to ask. I shouldn't have to ask.
And in a lot of families, and that's what happens, Letitia, in a lot of families. You can have, you know, a lot of families where there's only one person doing everything, and the other siblings or family members will never ask, hey, do you need anything? Is there anything I need to know? None of that.
But they do want a progress report on what's going on. And I get it. We're all adults. We all got families. We all got situations. But if you take the time to do what you want to do, you can do that too. So,
but you know, somebody told me something, because it was like that with me, Letitia. And I was told, I can't remember exactly who said it, but it affected me. And they told me, they said, God trusts you. You're the one that God trusts her with.
Funny you said that, because my cousin, who, oh my gosh, she's my rock. She's here. She's a minister. And she said that, you know, I didn't want to be resentful or angry towards my family. She said that it wasn't meant for them, that they can't, more than likely it was meant for you to do this. They wasn't meant for them. They can't handle it. So I take it as it was my calling. It was my mission.
It was your mission.
It wasn't their mission.
It was Tracy's mission. I realized it was my mission. It was hard. Other families like in the facility, other family members in the facility, Have they been coming along and speaking out with you, or are they sort of just standing back and watching?
I had some to show up at the meeting, the 2-hour meeting we had. I've gotten responses from them saying that they're very happy and excited that I have taken forth the effort to support them and their loved ones. But I really haven't gotten any actions per se. I mean, other than, what I would say, hey, you got to let them know what's going on, take pictures. And they do. I just keep them informed on what's going on, what facilities, like I said, the organization, National Consumer Voice, if they could be a part of that, because it seems like that they're having things that are going to the federal level that need to be advocated. That would help. And I think once I finish my volunteer online training for the Alzheimer's Association and I develop that support group, I will get more, hopefully, caregivers involved, and also the loved ones that are there to provide them with information they need to know. And the Alzheimer's Association provides free material, so I don't have to come up with anything.
Right.
They have all that. So.
Does the facility have like a family committee, or because of my, the facility is supposed to, though. I think they're supposed to have a family committee.
A lot of things they're supposed to do, like, I told them, why don't they have an open house on the weekends? Father's Day weekend would have been perfect. They have this big old dining area they don't use. They could have had representatives from different health organizations, the different resources that we've talked about to come in and talk about, whether it's preparing for wills, trust, just the different stuff they need to know, that loved ones and residents need to know what their rights are.
And it's almost like they don't want that, though. It's almost like they don't want things like that to happen in the facility.
I mean, it's common sense stuff I brought up. And then I've seen my mother progress a lot initially because I kept complaining about, what are you doing for activities? They would pencil whip and put stuff on a thing and said that this is what they did, which I know they didn't do. So now they're starting to actively do activities. I've seen her decline cognitively. Yes. She's been there, and I regret that I didn't realize that. And that's another thing I found out. I didn't know, because she qualified for Medicaid, and I knew about the program, but I didn't know I could do both. That being that she was in a facility, she could also participate in the PACE program, where they come and get her and do activities. I think that would have helped continue to stimulate, because they would sit there in the dining room and just see half of them sleep. They got the TV babysitting, and then the aides there would sit there and just look. They're on their phone, not doing anything actively. I would always come there during dinner time, take my phone and play music. You would not believe how the smallest thing as music lights them up. I did a party for my mother last Monday because her birthday was July 3rd. I did a celebration with them. I brought a wireless speaker. I did the hats. I did the little cupcakes. I found out, what I could bring, because initially I was having a hard time finding sugar-free cupcakes. They didn't have them, but they had sugar-free cookies. So I got that and the regular ones for people who were diabetics. I wanted to include everybody. Oh my God, they loved it. We danced, we sung, and they lit up. They actually, you could tell they haven't had that much fun in a very long time.
That's very cool. That's very cool. That's one of the reasons why we created the birthday gift program, Smile for Seniors, because we realized that they need to have an opportunity to smile and and feel a part of life, as opposed to the downside of what they're going through in the facility. Well, Letitia, I don't know, Tracy, did you have any other comments? So we're gonna wrap up.
No, Letitia, I just applaud you for your diligence in this, because it is awesome. And I'm hoping that everyone, would just take the tips that you've given us, and use them when advocating for their loved one.
And the last thing I wanted to say is that these people are still human beings. They didn't ask, to lose their cognitive skills. These people are educated. They're, in their previous life, educated, smart. You can't sit there and treat them a certain way. If they, blind, they're still human beings. Still treat them as if they didn't have these issues. You know, talk
They
to them
had
like
jobs.
they had jobs, they got degrees, and even if they didn't, I mean, these were productive citizens, and you should continue to treat them in their last years. Period. You know, just because they can't verbally tell you how they feel, and you do things and look at them a certain way, they may not be able to verbally communicate that, but they're seeing that with their eyes or hearing it with their ears. So I speak to all of them when I come in there. I don't just speak to my mother. I actually end up communicating with all of the residents there. And you know, they can't talk. You can see it in their eyes. They can speak with their eyes. And I say, hey, how's it going, so and so? And you know, they're human beings. Period.
And that's the thing we hopefully, we're hopeful that people will remember, the workers that are there. And we know that the environment is stressed and for most very toxic.
I tell them that I appreciate them before I leave. So I do tell the staff members.
There are some that really should not be in the field. They're in the wrong field. And I think that it's incumbent upon the administration to be able to know those who really aren't happy in that environment, because it affects the whole environment. And that can go from the nurses, the registered nurses, it can go from the nurse supervisors, it can go from the administrator. It all, it's affected greatly when they're not happy. Realize that they're dealing with human life.
Because that's exactly, and it becomes a domino effect.
It does.
When you have all the staff like that, each department is toxic.
Very much. And on top of the fact that these corporations are purchasing these nursing facilities at an alarming rate. Why they're allowed to do that, I don't know. But it's hard to run a facility like a corporation when there are lives that are being infected, when they need proper food, not just food to say they're giving them food, but quality food.
That's a whole nother podcast.
That's a whole other we haven't even locked in on that yet. And then the accountability of the agencies that are supposed to be looking after the betterment of these individuals that are in these facilities. The Department of Health, social services, Medicare. They all have a role to Medicaid. They all have a role to play in calling these facilities to accountability. And so the whole system needs to be revamped and needs to be reworked, and people need to be held accountable. And hopefully the federal government will start doing that. I hope we'll see, the initiatives that are gone forth by the administration now. So we're hoping that the Justice Department will come in and say, okay, let's just really get this done, because clearly at the state level, there are a lot of representatives that just don't seem to care. So
and I think if we start calling the whistle on the local state politicians now, instead, of course, not wait until General Assembly, we have a paper trail of, hey, I've sent you this emails, I've sent you these pictures. Why aren't you doing something?
You're correct. We wrote to all the representatives and got maybe, like we said, 6 or 7 responses, of which maybe 2 or 3 really showed an interest. We wrote to the mayor. The mayor just totally dismissed us.
I plan on writing them every week.
And we wrote to the governor at the time. So, clearly they don't consider this. One, it's not a campaign issue. They don't campaign on this subject. So clearly they don't have any regard for our senior citizens in these nursing facilities.
Most of them on those company boards.
Yeah. And they confessed that in the meeting and
see that's known. When you're sitting in the meeting, when senators actually say that, it's known. Nobody says anything because they already know it ahead of time. Yeah.
That's they're voting on bills that's demanding change in these nursing facilities, but at the same time, you're going to sit and say that, oh, you serve on many of the boards. How is that even allowed?
Yeah.
How is it right?
So
When
it needs to
people
go
are
to federal
literally
level.
dying, people are literally dying,
Mhm.
you know?
And that's why we say, and that is why in our organization we say profit over lives, because
Mhm.
that is what's happening
Mhm.
in this country.
Unfortunate.
Well, Letitia, I am very, very grateful for your advocacy. I mean, it makes us so, we've talked about this in our meetings,
Yeah.
all of us. I know you have two
Never
of us
think
here
it
today. You have two of us here today, but you know, there's our board and we do have members. And I'm telling you, we have discussed this because we appreciate you keeping us updated. Please continue to keep us updated because we are also in contact with people we can't mention right here, right now, but we are also in contact with some, I don't want to say, I want to say people who really can help this mission go forward in a very big way. And they are aware of what you're doing. And it goes further than you think. And sometimes a lot of these corporations discount the dripping faucet. And what happens with the dripping faucet, it doesn't stop, but whatever it's dripping on eventually wears down from it. Small drip, but it has an effect. And I think that's what we are. We are not going anywhere because we've lost greatly under the hands of this system. I mean, Tracy's without her father, I'm without my mother, and the story is horrendous on both ends. We could lay out countless stories right now of things that people are going through. A lot of corruption, a lot of just heartlessness when it comes to the lives of these elderly people who cannot advocate or speak out for themselves. And you know, it's hard. So I want to commend you, and I want to encourage you to keep taking on the mission. It'll change from time to time, but now you've got your feet in it. You just all together in it now. You're in it, and you know, God bless you because where He takes you, He will keep you. And I think one of the things that this whole journey for a lot of people is realizing that this isn't like you can sit and just say, oh, well, this has always been happening. It's not going to change. Well, we've heard that too. But change doesn't come if you don't become a part of the change. Let the change start with you. And I'd like to tell everyone that's listening to this podcast, if you want to see change in the situation, if you have a family member that's in a facility and you're going through a horrendous time, this is where you get to make steps towards helping change to come about. Write, continue to write and call your representatives because they are accountable. Write the Department of Health, call. They are also accountable. Call the Ombudsman's office. They want to help you. That's what they're there for. Make them aware of the situation. Knock on all the doors that you need to because this is your loved one's life that matters. And so even if you're a CNA and you work in these facilities, you're accountable. You are accountable. If you see something wrong, say something. Yes, we understand that you may lose your job, that this may happen, but sometimes life and the cause to protect life is priority. And it's hard. I understand that it's hard because you're working in a toxic environment a lot of times. But understand that these families are going through an horrendous time, seeing their loved ones die because of lack of quality care. When all the rules and all the laws on the books say that they are deserving, they are supposed to, and you are required to give quality care.
Exactly.
So,
And one of the things
mhm.
I'm sorry, Joanne, I just wanted to say what Letitia was talking about, how the staff in their hands are tied. And that is so true. Many times when I worked the profession, my hands were tied to some of the things that were going on. Some of the things I could not do because my hands were tied by the big wigs.
Yeah.
Well, I appreciate it. I appreciate you being on with us. Letitia.
Oh, I'm honored. I was really shocked.
No, we're here to support you in every way we can.
Yes, we
We're
are.
here to support you. If you ever just reach out to us, we'd be more than happy. And we're here to support other family members. If you're watching this podcast, we are here to support you. The Justice and Change for Victims of Nursing Facilities. So just reach out to us. We're on Facebook under the same name. Our email, jcfornfvictims.com at gmail.com. Did I get that right?
jc4nfvictims
I'm
at
sorry.
gmail.com.
It's jcfornfvictims@gmail.com.
Yes.
Reach out to us and we will respond to you. So thank you again. And we will see you next time at our next podcast.